You're watching the Medical Forum. Hyperkalemia. What is hyperkalemia? It is when your serum potassium levels reach beyond 5.5 millimoles per liter. Now, the main problem with potassium is that we need potassium to be in the ideal range between 3.5 to 5.5. But if potassium goes too high or too low, it affects mainly the heart. It affects the conduction system. It makes you prone to arrhythmias. So when you have hyperkalemia going on, you might have serious cardiac arrhythmias that would lead to even death. So it is important to correct hyperkalemias. So in an emergency, where hyperkalemia is considered a medical emergency, we need to act swiftly. So how do we correct hyperkalemia? So basically we have to try methods which could use alternative ways where we can take the potassium inside the cell. So what we do is we nebulize the patient with salbutamol. Salbutamol is a beta agonist which transitions your potassium into your cells temporarily. So that's what salbutamol does. Next, what we do is we give insulin and dextrose as an infusion. We give insulin 10 units with a 50% dextrose of 50 cc's. That would help, the insulin would help cellular intake of potassium. We do that. But before giving all of these, we need to take an ECG and make sure that there are signs of hyperkalemia. Tall tented T waves, lengthening of QRS complexes, and finally at the end you develop arrhythmias due to sine wave patterns. But before that you need to act. But if you do see tall tented T waves in your ECG, we need to give a drug to stabilize your heart, which is calcium gluconate. We give 30 cc of 10% calcium gluconate as a slow infusion, and then we give the treatment for hyperkalemia, and we need to make sure that drugs causing hyperkalemia should be stopped from the list, and we need to make sure if it is a persistent thing, we need to find out the cause. Is it due to renal impairment or is it due to some drugs? So if at all it is due to renal impairment, we need to make sure that our intake of potassium is less, and we need to be able to clear the potassium from the intestine. So we give some potassium binding resins like Calbind. So we give them orally so that we get down the potassium levels. We need to repeat serum electrolytes every 4 hours so that we see that the potassium gets into the range as quick as possible.